Coming up, we will be on location at Georgetown Pain Management in Greenbelt, Maryland, discussing advances in pain management and how they can help you relieve pain and regain the quality of your life with one of this region's top pain management physicians, Dr. Nett. Dr. Nett received his medical degree from the University of Wisconsin at Madison and completed his interventional pain management fellowship at the famous Cleveland Clinic Foundation. Dr. Nett is widely recognized as one of this region's top doctors. Welcome, Dr. Nett. It's a pleasure having you on our program.
Thank you for having me.
It's your first time, in fact, on the Top Doctors Medical Interviews. We have a lot to talk about. We have a few patients that are going to be joining us a bit later, but I wanted to begin, Dr. Nett, by asking you if you can please tell us about some advances that have taken place in pain management that can help so many folks out there, because as we all know, there are millions and millions of people here in America that suffer, not to mention worldwide, who suffer from chronic pain and debilitating pain to the point where it's impacted so many lives.
Interventional pain management is a evolving and dynamic field that employs various techniques to alleviate chronic pain. By definition, chronic pain is pain that persists more than 3 months, as opposed to acute pain that's expected after, say, fracture, surgery, or any kind of trauma. Chronic pain persists even after the offending agent is removed. For example, there are patients who develop minor trauma in their leg. It's completely healed, but they can have lasting pain. Among the techniques we have to treat pain management, we start by simple ones. For example, if a patient comes to our office and they complain of chronic pain, initially we try to help them by employing medications, physical therapy, and we'll ask them to come back. If they still have persistent pain, that's when we start doing non-invasive techniques such as selective nerve root blocks. If patients have a spine ailment that gives them neck pain going to their upper extremity, or lower back pain radiating to their lower extremity, we offer image-guided or X-ray guided selective nerve root block for maximum result. Previously, what was more common is what's actually widely known as epidural block. I describe it to my patient as being like shotgun approach. We identify a general area, insert the needle, sometimes with X-ray, sometimes aided by without X-ray, and we insert the medication. Some patients do well, some don't. But recently, most nerve blocks are done by X-ray guidance, so that the operator or the practitioner would know exactly where to put the medication for maximum result.
Your practice here, Georgetown Pain Management, and yourself are so cutting edge, doctor, in techniques and advancements that have been able to help so many people that you actually have trials that are taking place that are awaiting approval, and in some cases have already been improved in some really advanced areas that can even help that many more people out there.
I'm glad you mentioned that. In fact, this kind of procedure, although available in Europe, has not been widely accepted here in the US, and pairs are not authorizing us to do it. But despite that, we have been able to offer to some of our patients who are resistant to traditional way of pain management. In fact, we are excited. The study is going to start pretty soon in Georgetown University in conjunction to the Department of Anesthesia in Georgetown University Hospital.
Oh, that's wonderful. And these patients that you are utilizing this treatment on are folks that are participating in the trials with you.
Correct.
Once that receives full approval, which all indications are, if it's heading in that direction, you're going to be able to help that many more people.
Yes, in fact, if we are able to do more of those procedures, we can save some patients who require invasive procedures to help their pain. This is a patient come to the procedure room, they get sedation, we do the procedure within half an hour, and an hour later they're able to go home and continue with their life the next day.
Yes.
Without any complications.
Now, can you tell us about some more advancements? Like, I understand spinal cord stimulation is a treatment that's effective, that can help people out there, and some others that you offer.
Spinal cord stimulator is a procedure that we say for patients who have tried medication management for years without success, patients who had several surgeries in the back without any success, and patients who have either have tried spinal injections, nerve root blocks without success, or patients who have some conditions which are only amenable to this kind of intervention. Majority of the patients we offer spinal cord stimulator had prior back surgery.
So the pain had continued after those surgeries with other doctors, and then they came here to you, or you performed those surgeries and they did not work. Then if they're in that particular condition, then spinal cord stimulation is a good effective treatment.
Absolutely. If you are selective to who you choose, actually the procedure is very effective. But unfortunately, sometimes if you do not select your patient properly, this kind of procedure may not be effective. So it's very important for your viewers to know that before consenting to this kind of procedure, they have to make sure they have been worked up appropriately by an institution where they had extensive experience with this kind of procedures.
Yes, indeed, and I think you made some great points already. For the viewers out there who are suffering from pain, chronic pain in different parts of their body, it's basically a step-by-step process. You obviously you're looking at meeting with each of them individually, offering the least invasive is something even as simple as pain medication to see if that will help. If not, then you keep taking it a step further to within your array of treatments that you offer here and help so many people with, to see which is best for each individual patient and most effective.
It's very important point, because now it's an information age. Some patients who Google information based on their condition will come and ask me, I want the spinal cord stimulator done, or I want a morphine pump done, I am suffering, I'm sick and tired of waiting, I want this done. The first thing I ask them is, what have you tried?
Yes.
So if they have not tried, the philosophy in our practice is do less. If they have not tried the basic and minimal invasive approach, we do not jump into the spinal cord stimulator.
Yes.
And that kind of distinguish our practice from our competitors.
I can tell you right now, too many people and too many practices go for the more invasive approach far too soon. Then instead of you trying to see if the minimally invasive to non-invasive treatments will work, and in many cases we've heard and seen over the years those can work and eliminate the pain. However, the more invasive approaches, as you mentioned, should only be used as a last resort, and too many practices, instead of using that pyramid approach, as you said, non-invasive, less invasive, too invasive, going that way, you'd be surprised from what we've seen that a lot of practices unfortunately use the opposite approach, where they try to go more invasive, and if that doesn't work, then they go less invasive and have it all backwards, in other words.
Yes, I absolutely agree with that point. Another advance we can discuss about is a procedure called kyphoplasty or vertebroplasty. This procedure we offer for patients who have compression fracture in their spine. So classically, you'll see a frail elderly patient who have osteoporosis, minor fall, they develop fracture in the spine. You cannot do open surgery because that's very invasive. So traditionally, these patients are treated by very high dose narcotic and back brace. The problem is every time they move or they breathe, it hurts. And when you give this elderly patient very high dose narcotics, so all they do is sleep. So how you develop blood clot, develop pneumonia. So alternative to that, we offer what's called, like I mentioned, kyphoplasty. Essentially, under X-ray, we insert an introducer into the spine without making any cut. We can do it all in the needle without requiring any hospitalization. We put the needle in the spine and we put a cement that would stabilize the fracture, and you'll be surprised. Patient wake up, oh my God, it doesn't hurt. The reason why it works is that if you fracture yourself, doctors usually put casts, right, until the bone heals. So what we're doing with this procedure is expediting healing and allowing patient to gain a quality of life and minimize the risk of pneumonia, blood clot associated with bed rest, essentially.
And doing it all in a non-invasive way as opposed to an invasive procedure,
Yes.
and getting great results in the process.
Basically, they come in and they go home. And the reason why this is very important is this. I can use this as a segue to the importance of managing pain carefully. Is the problem we've seen recently, which has been evolving in the past 10 years, but which has really become a major problem recently, is the use of, or I should say, overuse of narcotics. As you can tell, you can treat any pain with narcotics, morphine-like medications, but unfortunately, we all develop, if you take the medication long enough, you develop tolerance and dependence. Those are biological phenomena. Some patients say, oh no, doc, not me. I can take the medication, no problem. But I tell them otherwise. I said, it's a biological phenomenon. Anyone who takes it will develop tolerance and dependence. Question is when? What we feel is addiction, which is a psychological problem. And I have to mention to your viewers that in a lot of states, more people die of with a complication related to prescription narcotics compared to motor vehicle accidents. So it's a major problem. And there are 3 times more people addicted to prescription medication compared to, I want you to emphasize this point, compared to folks who have heroin, cocaine, PCP, and all these illicit drugs addiction. You compare them, multiply them by 3, you have the number of people who are addicted to prescription medications.
My goodness.
And unfortunately, it's not because they're bad people, it's just that they go to a physician with a particular ailment, and the physician happened to be a bit liberal in managing the pain, but not having a thorough plan as to when they will stop taking the medication, and they develop dependence, tolerance, and eventually narcotic.
No,
Addiction.
That's a great point, Dr. Nett, and I think that's one of the points you touched on a bit earlier, but I appreciate you elaborating on the addiction of pain medication that so many people unfortunately have that problem out there. And you're absolutely right, and that's what separates, I believe, from what we've seen in our research, from the patients we've talked, from the folks we've talked to, and obviously yourself here today, is that your practice, unlike a lot of other practices, actually looks to, if you initially prescribe pain medication, it's for a limited time to see if that will help alleviate the pain, but at the same time looking to see what would eliminate the pain instead of being more of a Band-Aid. And that's what your approach is, to eliminate that pain and do it in the most least invasive manner possible without developing medication addiction that unfortunately so many other practices and doctors, not just in this field but in many fields, overprescribe the pain medication and cause these addictions in many ways.
Absolutely. It's very easy to prescribe the medication. You ask the important questions, you write the prescription, patients are happy for the time being. The doctors who are in their defense, tremendous pressure from insurance companies, they have to see as many patients as they can. So the easiest way they do is, if you as a patient, you go and complain pain, they write pain prescription, you are happy, the discussion is less, they can go see their next patient.
Yes.
Having said that, that's not, I believe that's not an excuse to write liberally these powerful narcotics without an exit strategy. It's like going to war. You have to have an exit strategy when you prescribe narcotic painkillers to patients who trust your judgment to manage their pain.
Yes, indeed.
Yeah. It is, in our practice, we prescribe medications, but we micromanage each and every one of our patients. We do a random tests to make sure of compliance. Not only that, I tell them, if they take more medication, it's bad for them. So you have to articulate that point, and most patients are responsive. You'll be surprised. There are some patients who come from different institutions who are used to getting a lot of painkillers. When we try to educate and make our time explaining the issue, some may not be responsive, but most folks, if you sit, spend your time and describe the issues at hand, they're responsive, and that's why we have a successful practice.
We're now going to meet a couple of patients of Georgetown Pain Management and Dr. Nett. Welcome, Michael. It's a pleasure to have you on our program.
Thank you very much. It's nice to be here.
We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, Michael, I'd like to begin, if I may, by asking you if you can please tell us what problem or problems were you experiencing that brought you to Georgetown Pain Management?
Certainly. Subsequent to a traffic accident, I have developed chronic pain in my back and both legs. And I have been to a number of pain clinics around the country over the years and had no success or no relief of my pain. And I was referred here by my internist and my internal physician, and then I found Dr. Nett.
And I'm sure that chronic pain must have been affecting your life.
Absolutely. Pain, as you know, affects every part of your life. It affects your family, it affects your job, it affects your ability to interact with other people, and to have probably the successful, happy life that people are looking forward to.
What happened next? You came here, you met with Dr. Nett, and can you please tell us what took place?
Yes, I met with Dr. Nett, and he said that there had been developments in the field of pain management that I was not aware of. And one of the developments was an internal pain pump that could provide for me medication and pain relief that pills could not give me. I had been taking a great many pills, and this was a problem as well, as people who take medication know. It clouds your thinking. It makes it very difficult to go through the day. And Dr. Nett explained to me the process that we would go through to try this pump and so forth, and so we went forward with that.
What happened? Did you come back over a few visits, or was it all done in one visit? Can you tell us about it?
After his consultation, which was very thorough, he examined my history, my physical condition, so there were a number of alternatives in terms of what could happen from a medical perspective. However, his recommendation was a trial of this pump. And so that's what we set up. We went back to the insurance company to get approval for this trial. And they were very enthusiastic in terms of this is leading technology. This is very, very indicated in my condition, and they were happy, for instance, to get me off the medication.
Yes.
And because this is an ongoing cost. I mean, we don't talk about cost, right? And we don't think about it. But I was spending $1,000 a month on pain medication. It's incredible. So the process was that he would go do this trial, and it was only a very short trial, less than a week, to see if I could benefit from this pump. The trial was performed. It was very successful, astoundingly successful for me. And so we scheduled time for the pump to be inserted.
Very good. So how do you feel now after all this has taken place?
Well, I'm sort of a poster child for the pump. It's interesting to know that I receive 1/300th of the medication that I used to receive. It's inserted directly into my spinal cord. Benefit for me, it doesn't come into my brain at all. It doesn't go into my bloodstream, so I don't feel the confusion and the fatigue that can come from taking opiate-based drugs.
That's right.
And yet, I have total pain relief.
That's wonderful. We're so happy to hear that, especially since in your case, you were a chronic pain sufferer for a long time prior to coming here to Georgetown Pain Management. And obviously, that state-of-the-art technology and treatment option regarding the pump that you've told us about has worked wonders for you.
Absolutely.
And lastly, before we let you go, for the viewers out there watching, for the many pain sufferers, and there's a ton of us out there, what would you tell them about Dr. Nett and his staff here at Georgetown Pain Management?
First, let me say that there is hope, that Dr. Nett and the staff here helped me find a way to live again, to have my life back, and I'm incredibly grateful for that. The care was supportive, it was comprehensive, it allowed me to understand the process as I went along. It helped me to understand how I had been involved in the medical community and how then I could extricate myself from this situation. And I have continuing care, and I'm just absolutely satisfied and thrilled with my care at this time.
Well, on that note, we're grateful you came and shared your experience with us.
Thank you very much.
Thanks for joining us and being a guest in our program, Michael.
You're welcome.
Our pleasure. Welcome, Rakesh. It's a pleasure having you on our program as well.
Thank you. It's great being here.
I wanted to just ask you the same initial question that I asked Michael, and that is, what occurred in your life as far as, was it an accident, a trauma that caused you to have pain that brought you here to Dr. Nett?
Well, I originally had a slip disc operation done, and they used a dye back then in the 70s. It's called a myelogram. And the dye causes the arachnoid membrane that surrounds your brain and spine to die and leaves you with mangled nerve roots, which is what originally happened to me. And that wasn't found out until 1979 when I was in a car accident.
My goodness.
And I ended up spending 2 years in bed after that with no feeling from the waist down, because they went in on exploratory and with a scalpel, because in those days they didn't have microsurgery. They did cutting around the nerve roots to relieve the pressure. So after 2 years living in pain and lying in bed, I got to a point where I could function normally. And I went on fine for about 5, 6, 8 years, whatever it was. Then all of a sudden the pain came back. I was on the floor, lying on the floor with my legs up and on morphine, pretty much non-functional. And I went to Dr. Nett. I was referred to Dr. Nett by my main physician.
So basically the pain flared back up after some time.
After a number of years, it just
My
flared
goodness.
back up.
So then you were referred to Dr. Nett.
I was referred to Dr. Nett. I got cortisone block done. Most people it lasts a few months, a year maybe. I'm one of the lucky ones. It lasted me 2 years.
Very good for you.
Ended up back on the floor, on morphine, non-functional. Called up Dr. Nett. Went back to him. Had to get another cortisone block done. And this time it lasted me 2.5 years.
So longer than the first
Right.
time.
And I got smarter this time. I didn't wait for the pain to get to the level of where I would need morphine again. The moment it started acting up and flaring up, I just finished my 3rd treatment with Dr. Ned 2 weeks ago.
Good for you. So you had the cortisone shot done, obviously, which has worked wonders for you.
Absolutely.
And as a result, you're good for at least the next few years, maybe even longer than 2.5.
Absolutely. I'm going to try and shoot for 3 this time.
That's right. But the key you learned in this process is not to wait until that pain
Right.
comes back to the point where you're really in suffering,
non-functional.
as opposed to coming when you start feeling it coming up.
Right.
So that way you still have full functionality, work, relax, enjoy, have fun with your
I'm
family.
leading a normal life.
Yes,
It's
yes.
amazing.
That's
The difference
wonderful.
it's made.
Yes, indeed. It's like a
And-
whole new you, right?
And I would not go anywhere else. He knows exactly what to do with me. And I'm incredibly appreciative of him.
Well, you know, we hear that from a lot of folks, not just you and Michael, in our research here of Georgetown Pain Management. They really go the extra mile to take care of you, not to mention Dr. Ned and how experienced and highly specialized and well-known he is for taking care of folks like you, Rakesh.
Oh, he's amazing. I would not go anywhere else.
Yes, indeed. And lastly, before I let you go, what would you tell the viewers regarding your experience with the staff here, Salah
The
and
staff
other folks?
here are wonderful. The ladies, when you come in for surgery, the ladies and the nurses take such good care of you. You feel perfectly relaxed and you have nothing to worry about. And that's the main feeling you get when you come in.
Yes.
And it's just amazing. They take really good care of you and make sure you do well.
Well, on that note, I'd like to thank you for coming down and sharing some of your experiences with us as well and being a guest on our program, Rakesh.
Thank you very much.
It was our pleasure.
Thank you.
We're now back with Dr. Ned. I must say, both Michael, Rakesh, very pleased with the results and actually 2 different treatment methods were utilized. One on Michael, it was the pump, and on Rakesh, it was actually the cortisone.
Absolutely. For example, if Mr. Rakesh was offered a spinal cord stimulator at a different institution, and fortunately for him, we were able to control his pain by employing selective nerve root blocks. Michael's condition was so severe, he exhausted nerve blocks, spinal cord stimulators, and very, very high dose medications that was interfering with his mentation and his ability to function until that's when we suggested that that's when we offered him the morphine pump, which has been very, very successful.
Yes.
In fact, he was able to get off all his painkillers that were interfering with his ability to function, and it's a good example, actually.
Yes, Dr. Nat, he has his life back. He said he hasn't felt this good in 30 years. He was suffering from pain for so long. He's got his life back. He's able to do things that he couldn't do for a long time. Not to mention that a lot of people don't realize, and Michael actually touched on it as well, that it's the families around you that suffer with you. When you
Absolutely.
suffer from pain. It's not just one individual, it's everyone who loves you and is your significant other that goes through that with you.
Absolutely, absolutely. In fact, a lot of patients, I'm glad you mentioned that point, patients who show up for chronic pain consult, in general, they come with their loved ones and they tend to elaborate and try to emphasize how bad they're feeling and how it's interfering with their social life. And it's a very important, point.
And for the many folks out there who are suffering from pain and chronic pain, debilitating pain, Dr. Nat, can you let us know and therefore let them know who could benefit from coming to you, who you can help, who would be a good candidate, who falls within the range of all the various treatments that you and Georgetown Pain Management offer here?
Very good question, actually. Although the majority of the patients we see are spine-related ailments, problem in their neck, problem in their lower back, problem in their extremities, we also see patients who suffer from cancer. Cancer can be in the digestive system, it can be in the spine, it can be anywhere in their body. We have ways of managing their condition. Again, like I said, we start with something simple. If we are unable to manage their pain with medications alone, we are able to offer them various interventions. So anyone who have cancer-related pain and is dependent on a very high dose medication, I truly believe we can make their life much more better. In fact, happy patients, there is a study actually, happy patients live longer. So our job is to make them happy and enjoy their quality of life. Patients who have chronic abdominal pain, mostly related to pancreatitis. Patients who have chronic pelvic pain, or it's called interstitial cystitis related pain. Those kind of patients, we do have intervention for them that can help them. For example, we not too long ago we had a patient who is just got married a few years back, trying to have a baby, but she cannot because she takes a lot of, a large amount of painkiller, narcotic painkiller. Her diagnosis was interstitial cystitis. Basically, she has inflammation in her bladder that doctors do not know why. So what we were able to do was offer her what's called hypogastric block. And I'm happy to inform you that she is offered medication and she's working on her getting pregnant with her husband.
That's wonderful.
So these are the things we do. Unfortunately, this kind of conditions unfortunately, the treatments available for this kind of conditions are not known to the wider public. Even, I call it our failure, even primary care physicians do not even know we're able to offer this kind of interventions for patients. Pain related to shingles, for example. We call it post-herpetic neuralgia. Most shingle outbreak, you have pain, you get medication, it gets better. More than 90% of the patient. But for those unfortunate patients who develop persistent pain, more than 4 or 5 weeks,
Yes.
if we are able to treat them with the interventions we have, we are majority of the time able to prevent chronic debilitating condition known as post-herpetic neuralgia. Especially for folks who develop shingles in their eye, that is an emergency because they can lose their eyesight, but we do have interventions we offer to minimize, if not eliminate, the risk of chronic condition related to shingles.
Yes.
Patients who have headaches. Now, I must admit to your viewers, not all headaches are amenable to interventions, but what we term cervicogenic headache, or headaches that start in the back of the neck and radiates to their eye, those are amenable to intervention. So we will be more than glad to evaluate patients with those kind of conditions. I had patients who had headache for many years that we do intervention successfully. Although we offer various interventions to help our patients, we also do a traditional medical management. Not all patients are a candidate for interventions, or I should say, not all conditions are a candidate for intervention. That's why we have a carefully tailored medical management approach that is designed in minimizing side effects and increasing function.
Certainly, you've educated us, enlightened us on how you can help so many folks out there like you're already helping here at your practice.
Thank you for having me. It was a very important topic.